Hi everyone, welcome back to this short tutorial on nursing pharmacology revision. So let's understand some of the important topics which can be asked in your exams. So first is the drug agonist. So as you know, drug agonists are the one which will going to act on a particular receptor and it activates the physiological process. Here salbutamol is a beta 2 agonist which will going to activate beta 2 receptors and cause bronchodilation, whereas morphine acts on the opioid receptor and it has got agonistic activity and it helps in relief of the pain. So mechanism, basically they activate the specific receptor to elicit the physiological or the biological response. So where do we use salbutamol? Salbutamol is used in the treatment of asthma as well as COPD, and morphine is used for relieving the pain. So adverse effects associated with salbutamol is it can cause tremors as well as hypokalemia, and respiratory depression is the most common side effect of the morphine. Next, coming to the drug antagonist. These are the drugs which will going to block the activity of the receptors. So the example is the propranolol, which inhibits the activity of the beta receptor mediated actions. So it is a non-selective beta blocker, whereas naloxone is a opioid receptor antagonist. So basically it blocks the receptor activity by inhibiting the biological responses. So as you know that propranolol inhibits the beta activity, thereby it can be used in case of hypertension. Naloxone is an opioid receptor antagonist. It is used to overcome the opioid overdose or opioid toxicity. So side effect with propranolol is, since it inhibits the beta activities, it inhibits the beta 1 receptor in the heart, being a non-selective which blocks both beta 1 as well as beta 2. It can cause bradycardia, decrease in the heart rate, as well as it can cause bronchoconstriction. So it should not be given in case of asthma. So contraindications for use of propranolol is bronchial asthma. So withdrawal symptoms can be seen with the use of naloxone. Next, coming to the drug synergism. So synergism, the example is the amoxicillin and clavinic acid and alcohol in the diazepam. So here the alcohol and diazepam both are the CNS depressants. Here amoxicillin is inhibited by the beta lactamase, or it is broken down by the beta lactamase. So this clavulanic acid will going to inhibit the beta lactamase, thereby it increases the effectiveness of the amoxicillin. So the combined drugs produces the greater effect than the individual effects. So basically we use amoxicillin and clavulanic acid in the treatment of the microbial infections. So sedation is the one where we use the ethynyl alcohol as well as the diazepam, which is a benzodiazepine. So with the use of the amoxicillin and clavulanic acid, there is an increased GI distress, as well as with alcohol and diazepam there will be excessive sedation. So next, coming to the, so this is the same example. So next, coming to the routes of administration. So we'll learn about the advantages and the disadvantages. So oral route is given by orally through the mouth. Usually we give tablets, syrups, capsules, etc. The example is paracetamol tablet as well as the metformin tablet, which is used for diabetes mellitus. So next is the advantage. So it is very convenient for using oral route in the form of tablets or a capsule or a syrup, etc. And it is easily administered by the patient themselves. it is more economical. There is no requirement of any special equipment or professional assistant for the intake of the medications, and it is very safe. It is a non-invasive method where it does not involve any risk when compared to the intravenous administration. So the disadvantage is it has got delayed onset of action. So since absorption takes time, it can lead to delayed therapeutic effect, and there will be variable absorption because of the first pass metabolism. So it depends on many factors like food intake, gastrointestinal condition, etc. And also the first pass metabolism will going to affect the concentration of the drugs which are administered through oral route. So some drugs are metabolized in the liver before reaching the systemic circulation, thereby reducing the efficacy of the drug. So it is called as first pass metabolism. If the drug undergoes, if the higher is the first pass metabolism, what will happen to the concentration which is reaching the systemic circulation? The concentration reaching the systemic circulation will be very less. So next, coming to the intravenous route of administration, which is given directly into the bloodstream. So the example is the adrenaline, which is used to treat for anaphylaxis, which is given by IM route as well as IV. IV only in case of the very emergency condition, and it has to be diluted compared to IM. So but IM will be the drug of choice in case of anaphylaxis if you were to give a adrenaline, then the morphine for pain relief. So advantage is it has got rapid onset of action since you are giving the drug directly into the bloodstream, so that it has got the quick action. So precise control of the dosage can be made, and it is suitable for poorly absorbed drugs. So those drugs which cannot be taken orally can be given through intravenous route. The disadvantage is you need to be have a aseptic condition, and it's an invasive measure which requires a professional skill and professional assistance. And there's a risk of infection, potential for introducing the infection through the needle. Aseptic condition should be followed, and adverse drug reaction. So immediate reaction can occur, such as anaphylaxis as well as the other hypersensitivity reaction. So next, coming to the intramuscular route, where the drug is given into the muscle. Usually it is the deltoid muscle or the gluteus maximus muscle, gluteus medius. So here the example is vaccines, the flu vaccines, vitamin B12 injection, diclofenac injection, etc. The advantage is it has got faster onset of action but lesser than the IV route. When compared to the oral route, it has got faster absorption because the muscles have very rich blood supply, which will help in quicker absorption than the subcutaneous route. And it is suitable for large volume of administration. Means IV you can give large volume compared to IM, compared to subcutaneous, compared to intradermal, and intradermal will be very less. So next is it is effective for depot preparation, which contains oily preparation, so that these drugs has to be released very slowly into the muscles. Disadvantage of intramuscular route is it can cause pain at the site of injection when you are giving large volumes, and there's a risk of tissue damage, and repeated injection can cause muscle damage, and it can lead to abscess formation also if the injection is not given properly. And there is a risk of thrombophlebitis if you are injecting into the vein as well. And it requires a skill, again it requires a professional assistance. So next, coming to the subcutaneous route, which is given underneath the skin. The example is the insulin, which is used for diabetes. It is given through subcutaneous route. This can be self-administered, and heparin, which is anticoagulant for blood thinning, it is given through subcutaneous route. So the advantage is it is easier than the IM as well as IM. It can be self-administered. So training has to be given, and it produces a gradual absorption because there is a slow release of drug into the bloodstream, and it will have a sustained effect and fewer complication when compared to the intravenous route. So the disadvantage of subcutaneous route, again, it is painful procedure. If the route is repeated at a same site in a diabetic patient, it can lead to fibrosis, it can lead to lipodystrophy as well. So only limited volume, only small volume can be administered through subcutaneous route when compared to the IM as well as the intravenous route. It has got slow onset of action when compared to the intravenous route. The onset of action is very slow. And next, coming to the drugs which are given through topical route. Topical route means these are the drugs which are applied directly onto the skin surface. So here the example is the hydrocortisone cream, which is used most frequently in dermatological conditions to treat the inflammation, and lidocaine patches for localized pain. So the advantage of topical preparation is, since it is a localized preparation, so it produces localized effect, it will not going to produce any systemic side effects. So it will going to minimize the systemic side effect, because the drug is directly applied onto the site where it is required, and lower risk of side effects. There is no or lesser risk of systemic toxicity when compared to the other routes, and it is more convenient to apply, does not require any professional assistance. So the disadvantage is it has got limited absorption, only a small amount of drug is absorbed through the skin surface, and some of the drug can cause skin irritation. So the prolonged use of these drugs can cause local irritation as well as the allergic reaction. And again, it has got the slowest onset, and effects may take longer time when compared to the other routes. So next, coming to the drugs which are given through inhalational route. So these are the drugs which are acting on the lungs. So usually it will be given through the nebulizer or inhalers or rotainhalers, or in the form of the meter-dose inhalers. Salbutamol, which is used to treat asthma, it is given through inhalers. Oxygen for respiratory distress. So the advantage is it has got rapid onset of action because of the large surface area. The lungs as alveoli has got large surface area. The drugs reaches the lung and bloodstream very quickly. Almost it is comparable to the intravenous route. So it has got direct effect on the lung, ideally for respiratory condition, and there is a decrease in the systemic side effect. There is a decrease in the systemic side effect as well, and it minimizes the systemic side effect because it acts on the localized part. That is, localized means it acts only on the lungs. So the disadvantage is it requires a proper technique. Without proper use of the inhaler and nebulizer, the drug effect will not be produced as required, and there is a risk of lung irritation as well, coughing, wheezing, etc. If you are using a steroid, the patient has to rinse the mouth, because if the steroid gets accumulated on the pharynx or on the throat, it can increase the risk of candidiasis. So that's why you need to ask the patient to rinse the mouth if it contains the steroids in the inhalers or the meter-dose inhalers or the nebulizers, etc. So, and limited drugs, not all drugs can be given through inhalation route. So this is the disadvantage. So next, coming to the transdermal route, where the drug is given through the skin in the form of patches or ointments. So the example is the nicotinic patch or the fentanyl patch, or you have a hyoscine patch for morning sickness, hyoscine, or it is also called as scopolamine. So it is used for motion sickness. So next advantage is it produces sustained release. Drug will be released very slowly over a period of time at a constant rate, and it is very convenient, non-invasive, very easy to use, good for long-term therapy. Ideally, the condition requiring consistent drug levels. So the disadvantage is it can cause skin irritation due to prolonged use, and also only limited drugs can be used in the form of transdermal patches, and the risk of overdose can be possible if there is a release of the drug at one point of time. That is called as dumping phenomenon. Usually drug will be released at a constant rate. If the pores are not properly made and if there is a failure in the release of the drug, there is a point where at one point there can be whole of the drug can be released into the circulation. So this is the side effects which are expected with the transdermal patches. And usually the motion sickness, you'll be using the transdermal patches behind pinna or the mastoid process, behind pinna or the mastoid process. So next, coming to the adrenergic drugs, just I will be going through the briefly which drug belongs to which group and where it is used and what is the side effects and what are the uses. So adrenaline and dopamine, they belongs to adrenergic group of drug. Basically it will stimulate the adrenergic receptors like alpha, beta, etc. So usually the alpha is present in the blood vessels, so usually it causes vasoconstriction. So beta 1 is present in the heart, beta 2 is again present in the blood vessel as well as the blood vessel as well as in the lungs. So in the heart it produces increase in the heart rate stimulation. Beta 2 stimulation, it can cause blood vessel dilation, and also in the lungs it causes bronchodilation. So adrenaline, since it is a drug of choice in case of anaphylaxis, it is given through IM route. It has to be given very, very carefully because it will take care of the angioedema. It increases the blood pressure, etc. Dobutamine is a drug of choice in case of cardiogenic shock. It mainly acts on the beta 1 receptor without any reflex tachycardia. And side effects are, since adrenaline can increase the blood pressure, you should be very careful when you are giving in patient who are hypertensive or in a pre-hypertensive phase. It can cause hypertension, that is increase in the blood pressure, and it can cause tachycardia, increase in the heart rate. So there can be palpitation, tremors, etc. as well. So next, coming to the anticholinergic drug, these are the drugs which prevents the cholinergic activity or the muscarinic activity. The classical example will be the atropine, which blocks the muscarinic receptor, especially the M3 receptors. Ipratropium bromide is also the M3 blocker, which mainly block M3 in the bronchial tree or in the lung. So thereby it decreases the lung secretion. Thereby it can be used in case of COPD as well as in case of the asthma individuals. So again it is given through inhalational route. But atropine is a drug of choice. Please remember, drug of choice for OP compound poison, that is organophosphate poison. So the mechanism of action is it blocks the acetylcholine at muscarinic receptors, and uses atropine can be used for bradycardia. Basically it will going to increase the heart rate, and ipratropium bromide in case of the COPD. And next we have adverse effects, like usually the atropine will cause dry mouth, and there will be retention of urine, and there will be a constipation, difficulty in passage of the stools, and there is what is called as blurring of vision because of pupillary dilation, etc., and the constipation. And next we have antihistamines. These are the drugs which are given for allergic reactions. We have loratadine and ranitidine. So please remember, here also you have first generation and the second generation. First generation are highly sedative, and second generation are less sedative. That means it increases the sleep, whereas there is no, as such, it produces less sedation. So that's why these second generation can be given in case of patients like drivers who requires constant attention, etc. This should not be given in case of drivers because it causes sedation. So we have loratadine as well as ranitidine, which mainly block H1 receptor. Loratadine, ranitidine is the drug which blocks H2 receptors in the stomach. So basically, loratadine is used for as an anti-allergic drug, and ranitidine is used in case of the peptic ulcer. And mechanism of action, it blocks histamine receptors. So loratadine is used in allergic rhinitis in case of cold, etc. And peptic ulcer, you use ranitidine. Apart from that, in peptic ulcer, you also use proton pump inhibitor, like example is pantoprazole. And side effects, since H1, especially the H1 first generation, are more prone for sedation, and H2 blockers are known to cause gynecomastia, especially the cimetidine are known to cause gynecomastia. And next, coming to the antiemetic agent. Antiemetic means these are the drug which prevents the risk of vomiting. So we have ondansetron and the metoclopramide. Basically, the ondansetron is a 5-HT3 antagonist. It blocks serotonin and dopamine receptors in the chemoreceptor trigger zone, CTZ. So triggering of these will lead to vomiting. So what you are doing, you are blocking the 5-HT3 as well as dopamine. So thereby what happens, there is no stimulation of CTZ. So metoclopramide, it blocks the D2 receptors in the periphery. So next, basically it is used in case of postoperative, to prevent postoperative nausea and vomiting, and also to treat chemotherapy induced nausea and vomiting as well as radiotherapy induced nausea and vomiting. So side effect will be the ondansetron can cause the headache, as well as metoclopramide can cause extrapyramidal side effects. Since it crosses the what is called as the blood-brain barrier, so it can cause the extrapyramidal side effects. And next we have antipeptic ulcer drugs. Here again we have omeprazole, which is a proton pump inhibitor, and this is the H2 blocker. And the mechanism, basically it reduces the gastric acid secretion via inhibiting a proton pump or by inhibiting the H2 receptors. So basically it is used in gastrointestinal or gastroesophageal reflux disorder, as well as in case of gastric ulcer. That is the acidity, what you call as in general term. So adverse effects will be hypomagnesemia can occur with omeprazole. There can be decreased in the gastric acid, which can lead to decreased absorption of vitamin, and this can lead to malabsorption as well. And ranitidine can cause diarrhea. So next, coming to the anticoagulants, we have oral anticoagulant and parenteral anticoagulant. So oral, you have got warfarin, and parenteral you have got heparin. So we have got warfarin, which is given orally, heparin is given through subcutaneous route. So the mechanism is they inhibit the clotting factor, like important is vitamin K and the thrombin, and basically it is used in the treatment of the DVT, that is deep vein thrombosis prevention, and also to prevent the stroke in case of atrial fibrillation. And adverse effect, it increase the risk of bleeding, and also it can cause heparin induced thrombocytopenia. And also you should remember, to overcome the warfarin overdose, you need to give vitamin K as the antidote. In case of heparin poisoning, you need to give protamine sulfate. Protamine sulfate will be the antidote. And next, coming to the anti-diabetic drug, here you need to remember two important drugs. One is the oral hypoglycemic agent. Most commonly used is the metformin, as well as sulfonylurea. You have the gliptins, you have the SGLT2 inhibitors, etc. And we have a parenteral route, That is the one thing you should remember is the insulin. So we have metformin given through oral route, insulin most commonly it is given through subcutaneous route, but in case of diabetic ketoacidosis, please remember, in case of diabetic ketoacidosis it is given through IV route, especially you're going to use the regular insulin through IV route. And mechanism of action, it reduces the gluconeogenesis, and insulin will facilitate the glucose uptake into the skeletal muscle. And it is mainly used in case of insulin is the main drug which is used in type 1, as well as it can be used in case of type 2 if the oral drugs are not controlling the condition. So type 2 usually you start with metformin. If it is not controlled, you will be shifting into the insulin. So before shifting, you're going to try the combinations like sulfonylurea and other group of anti-diabetic drug. So what is the side effect? There is more prone for GI upset with the metformin. Metformin can cause vitamin B12 deficiency. Rarely it can also cause diarrhea as well. And apart from that, insulin can cause most commonly hypoglycemia, that is decrease in the glucose levels. Is that clear? So metformin, you should remember, B12 deficiency, and also the metformin is utilized in the treatment of infertility due to PCOD or PCOS syndrome, and it will not cause hypoglycemia. Coming to the corticosteroids, a very important drug. The example is the prednisolone and dexamethasone. Main mechanism of action is it has got anti-inflammatory action, as it will suppress the immune response. So usually the corticosteroids will going to inhibit the phospholipase A2 activity, which is present on the lipid membrane. Basically it will going to inhibit the arachidonic acid pathway. So once arachidonic acid pathway is inhibited, what will happen? There won't be synthesis or decrease in the prostaglandin. Prostaglandin, as you know, it is the inflammatory agent. So this corticosteroid, by inhibiting phospholipase A2 activity, they will inhibit the conversion of lipid membrane into the arachidonic acid. So basically it is used to treat autoimmune conditions like rheumatoid arthritis, etc. And it can be used in case of severe asthma. You can use the inhalation corticosteroids like budesonide, beclomethasone, etc. And apart from that, it's also more prone for side effects, unless once you start with the corticosteroids, you need to do the tapering of the dose. So it should not be stopped abruptly. And adverse effects is, it can cause osteoporosis, it can cause hyperglycemia, it can cause cataract, it can cause Cushing syndrome, etc. And in diabetes, what will happen? There is an increased risk of hyperglycemia. So next, coming to the antihypertensive medications. So under this, you need to remember at least the amlodipine, which belongs to calcium channel blocker. Lisinopril belongs to AC inhibitor, and also you can remember beta blocker. And you have ARBs, angiotensin receptor blockers, like losartan. You have diuretics as well. Diuretics like the thiazide diuretics, etc. So basically these drugs will going to reduce the blood pressure by dilating the blood vessels or decreasing the cardiac output. And basically it is used in hypertension as well as in case of heart failure. Lisinopril can be used as AC inhibitors. Spironolactones will going to decrease the cardiac remodeling, or it inhibits the cardiac fibrotic changes. So adverse effects is amlodipine will cause peripheral edema. Dry cough is the classical side effect of the lisinopril. It can cause hyperuricemia, and also amlodipine can cause constipation, etc. So next, coming to the antiplatelet agent, which prevents the aggregation of the platelets. So usually you should remember aspirin and clopidogrel. Aspirin is a non-steroidal anti-inflammatory agent. At low doses, what will happen? It acts as a antiplatelet agent. Low dose means what? Around 75 to 325 milligram. But what happens to the moderate dose as well as the higher dose? Higher dose, it produces anti-inflammatory action. At moderate dose, it produces the antipyretic action as well as the analgesic action. So aspirin and clopidogrel will be a dual antiplatelet drug which will be more effective, and mainly it inhibits the platelet aggregation to prevent the clot formation. So basically used in treatment of myocardial infarction as well as in the patient with post myocardial infarction to prevent the further attacks, and also in the prevention of stroke. Side effect, it can cause GI bleeding as it prevents the platelet aggregation, and also they are more prone for rashes. Next, coming to thrombolytic agent, these are drugs which will going to break the clot, which is required in case of MI patient, which is mainly due to the clot which is formed in the coronary artery. So basically we have an example of alteplase and streptokinase, and mechanism is they break down the fibrin clot by activating the plasminogen. So basically it is used in case of acute ischemic stroke like MI, in case of pulmonary embolism, etc. So the adverse effects will be the risk of hemorrhage and hypotension. So next, coming to the hypolipidemic agent, these are the drugs which will going to decrease the cholesterol levels, or which will decrease the fat. So we have examples such as atorvastatin and fenofibrate, and these drugs will lower the cholesterol level by inhibiting the HMG-CoA reductase enzyme, which is the rate limiting enzyme, and this enzyme activity is more at the night. So thereby the atorvastatin is given during the night, that is during bedtime. During bedtime the dose will be given, and it also increases the lipolytic process. So where do we use this hypolipidemic drug? Basically in hypercholesterolemia and hypertriglyceridemia. So adverse effect is the atorvastatin is more prone for specifically the myopathy, especially with atorvastatin. It can cause the rhabdomyolysis. It can cause inflammation of the muscles, it can cause muscle pain, it can cause breakdown of the muscle fibers as well. So fenofibrate are more prone for GI related side effects. So next, coming to the anti-asthmatic drug, these are the drugs basically we use beta 2 agonist we can use, that is the salbutamol. You can use the corticosteroids, basically the inhalers like budesonide. You can use montelukast, which is the leukotriene receptors inhibitor or leukotriene blockers, and also you can use like ipratropium bromide, which is a anticholinergic. So we have salbutamol, montelukast examples, and basically it going to relax the bronchial smooth muscle, thereby it cause bronchodilation. And leukotriene are the inflammatory mediators. By blocking leukotrienes, you are going to produce the bronchodilation. So in acute asthma is the use of salbutamol. Salbutamol is used in acute asthma, and montelukast in case of chronic asthma. And nowadays montelukast has been a black box warning for neuropsychiatric side effects. So it should be used very carefully. So tremors is the side effect of salbutamol. Salbutamol can cause hypokalemia, and headache is the side effect of montelukast, as well as it can cause neuropsychiatric problems. Next, we have antitussive agents. So the example we have is the dextromethasone and codeine, which are usually seen in case of cough medications. The mechanism is tussive, means it prevents it suppresses the cough reflex by acting on the cough center. Basically it will going to decrease the dry cough. So it is mainly used in case of dry unproductive cough as well as post-infectious cough. And main side effect is dextromethorphan can cause the drowsiness, and codeine is responsible for constipation. And next we have expectorants. These are the drugs which we need to remember: guanfacine and ammonium chloride. And these drugs will going to increase the secretion of respiratory tract. They are going to increase the expulsion of the respiratory secretions. So they facilitate in expulsion of the respiratory secretions. So it is used in productive cough and bronchitis. So in dry cough, what we use is the antitussives. So remember, antitussives is used for dry cough, whereas expectorants it is used for the productive cough, or it is also called as wet cough. This is called as non-productive cough. Dry cough is called as non-productive cough. Expectorant is used for productive cough and bronchitis. Side effect will be the nausea and dizziness. So next, coming to the mucolytic agent. So the example is the acetylcysteine and bromhexine. Mucolytic means they are going to break down the mucus secretion, so that the mucus can be expelled out easily. So there is a break in the disulfide bond which is present in the mucus by mucolytic. Thereby it reduces the viscosity of the mucus. Thereby the mucus can be easily expelled out. So where do we use this? In case of COPD, in case of cystic fibrosis, again the side effect will be, since it will be expelled through the bronchus outside, so it can cause bronchial irritation as well as bronchospasm can occur, as well as GI irritation can occur. So next we have a decongestant. So usually these are the adrenergic group of drugs. We have phenylephrine, we have and pseudoephedrine. So basically they cause the constriction of the nasal blood vessels by activating the alpha adrenergic receptor which is present in the blood vessels. So where do we use for nasal congestion? In case of cold, and also in case of allergic rhinitis. So adverse effect, once it is stopped, it can cause rebound congestion, and also since it stimulates the blood vessels, it can increase the risk of blood pressure, hypertension. So next we have drugs which is used for congestive heart failure. So please remember, we use digoxin to increase the contractility, and furosemide, it increases the diuresis. It will remove the excessive water from the body, as well as this spironolactone, which belongs to the potassium sparing diuretic. They are the life-saving congestive heart failure drug, where it prevents the remodeling process as well. So there are drugs which can increase the survival rate. Those are the beta blockers. We have AC, angiotensin converting enzyme inhibitors. We have ARBs. We have spironolactone, which is a diuretic. We have ARNI, neprilysin inhibitor, angiotensin receptor blocker plus neprilysin inhibitor, as well as sacubitril. So mechanism is they are going to increase cardiac contractility. Digoxin will going to increase cardiac contractility, whereas the furosemide helps in reducing the fluid overload. So which is a diuretic agent. So these drugs are used in case of CHF as well as in case of atrial fibrillation. And also furosemide is used in case of edema, generalized anasarca. So the side effect is digoxin, since it contracts the cardiac muscle, they are more prone for arrhythmia and tachycardia. And furosemide can cause electrolyte imbalance. It can decrease sodium levels, it can decrease potassium levels, it can decrease magnesium levels, etc. And also it loses the calcium. It can cause hypocalcemia. And next, coming to the shock management. Again, in the shock, you need to remember, one is fluid management has to be done. So if the volume is lost, you can give with the normal saline or ringer lactate. And if the patient is not unconscious, you need to give DNS. And if the blood is lost, you need to give a whole blood has to be given, that is blood transfusion has to be done. Apart from that, to treat the hypotension as well as the cardiogenic shock, you should give adrenaline and the dopamine. So adrenaline is a drug of choice for anaphylactic shock, anaphylactic shock. This is for cardiogenic shock. So basically it will stimulate the adrenergic receptors and improves the cardiac output and blood pressure. So dopamine is used in septic shock as well as cardiogenic shock, and anaphylactic shock you are going to use adrenaline. So side effect, again, it can increase the risk of blood pressure, it can raise the blood pressure, and it can precipitate hypertension, it can cause tachycardia as well as arrhythmia. So next, coming to the anti-malarial drugs, very important. So at least remember chloroquine. So nowadays there is a chloroquine resistant malaria. So in case of chloroquine resistance areas, you need to give a artemether lumefantrine, that is the artesunate combination therapy or the artemether combination therapy. So mechanism, they interferes with the parasite metabolism and also they inhibit the nucleic acid synthesis. So basically used to treat malaria infection, as well as chloroquine can be given for malaria prophylaxis. So what are the side effects which are seen with the anti-malarial drug? Especially with chloroquine, the most common side effect will be nausea and vomiting. GI related side effect will be more, but specifically on accumulation of the chloroquine, the drug can cause retinal damage. It causes retinopathy as well as GI upset. So next, coming to the antifungal group of drug. So we need to remember fluconazole and the amphotericin B, and basically these drugs will going to inhibit the cell membrane of the fungal cell wall fungus. So basically they inhibit the ergosterol synthesis which is required for the fungal cell wall synthesis. So these drugs will going to inhibit the ergosterol synthesis and disrupt the fungal cell membrane. So amphotericin B will form the pore and it will cause leakage of the contents from the fungus, thereby fungus will going to die or fungus will be killed. So they are basically used in systemic fungal infection, amphotericin B and fluconazole for candidiasis. So side effects, amphotericin are more prone for the nephrotoxicity. That's why to prevent nephrotoxicity, what you are giving is the liposomal forms. Liposomal amphotericin B can be given. Fluconazoles are causing hepatotoxicity. So next, coming to the penicillins, which are the beta-lactam group of drugs. So under beta-lactam, please remember you have one is the penicillins, you have cephalosporins, and you have carbapenem, you have imipenem, etc. Monobactam, carbapenems, monobactams, etc. All these are the cell wall synthesis inhibitor. So we have a penicillin G, amoxicillin. Basically these drugs will going to inhibit the bacterial cell wall synthesis, and they are used for streptococcal infection and syphilis. For syphilis, the penicillin is the drug of choice. So basically these beta-lactam are more prone for allergic reactions. That's why the test dose has to be given before giving the proper dose. So you need to go for test dose or hypersensitivity testing. So it can also cause GI upset. So next, coming to the cephalosporins, again we need to remember there are cephalosporin first generation, second generation, third generation, fourth generation as well as fifth generation. So usually first generation will going to cover gram positive organisms. As the generation progresses, it also covers the gram negative organisms, and also the fifth generations will be able to treat pseudomonal infections. So we have ceftriaxone and cefalexin. Ceftriaxone is the most commonly used drug, and it is the third generation cephalosporin. So basically they inhibit the bacterial cell wall synthesis. So basically used for treatment of the bacterial meningitis as well as skin infections, skin and soft tissue infections. So usually it causes again the allergic reaction, hypersensitivity reaction, and also diarrhea. So next, coming to the macrolides, they have got broad spectrum of activity. We have azithromycin and the erythromycin. They basically inhibit the bacterial protein synthesis by binding to the 50S ribosomal unit. So which is the drug which inhibits the 30S inhibit the protein synthesis by acting on 30S ribosomal unit, it is the tetracycline. It is tetracycline. So these are used in the treatment of community acquired pneumonia, that is CAP, and also as a part of the H. pylori regimen it can be used. So erythromycin can be used in H. pylori infections. So in H. pylori infection there will be a regimen of inclusion of pantoprazole, omeprazole or rabeprazole with metronidazole plus clarithromycin or erythromycin, etc. So side effect, these will produce QT prolongation. They are more prone for arrhythmias as well as GI side effect. Next, coming to the anti-tubercular drug, I will not go into the every part of the drug. So you need to remember there is a first generation anti-tubercular drug HRZD, that is the isoniazid, rifampicin, pyrazinamide and ethambutol. And streptomycin was also considered as the first line drug, and there are second line drugs also. So basically you need to remember these drugs. Basically these drugs will going to inhibit the mycolic acid synthesis. So mycolic acid is required for the Mycoplasma tuberculosis infection or Mycoplasma bacterium. So they inhibit the mycolic acid synthesis, especially the isoniazid. Whereas the rifampicin will going to inhibit the RNA synthesis. So these are used for active tuberculosis as well as latent tuberculosis. The side effect will be they are more prone for all of these anti-tubercular drugs are more prone for hepatotoxicity, and isoniazid will cause a peripheral neuropathy, and ethambutol can cause optic neuritis. Rifampicin can also cause flu-like syndrome, and also it can cause orangish urine or orangish secretions all over the body. So next, coming to the antiretroviral drugs, these are the drugs which are used to treat HIV infections. So we have zidovudine, efavirenz. Basically they inhibit the HIV replication by targeting the reverse transcriptase. So zidovudine will going to inhibit the reverse transcriptase enzyme, whereas efavirenz will going to inhibit the integrase enzyme. So there are protease inhibitors also which can be used for the HIV treatment. So basically it is used for HIV treatment and HIV prophylaxis, that is a heart therapy. Heart therapy is used. And adverse effects, zidovudine is more prone for anemia as well as it can cause skin pigmentation. Efavirenz can cause neuropsychiatric effect, etc. So next, coming to the antiviral drugs, especially the acyclovir, ganciclovir, etc. So we have oseltamivir and acyclovir. So these basically inhibit the viral replication by blocking the neuraminidase. So oseltamivir will prevent the viral replication by blocking the neuraminidase enzyme, and acyclovir will inhibit the DNA polymerase activity. So basically oseltamivir is used for treating influenza infections, whereas acyclovir is used to treat herpes simplex infection as well as herpes zoster infections. So side effects, oseltamivir can cause nausea, whereas acyclovir can cause renal toxicity. So next, coming to the anti-helminthic drugs. So under anti-helminthic drugs we have albendazole and mebendazole. Basically it will going to inhibit the microtubule formation as well as it disrupt the worm metabolism. So basically it will going to kill the worms. So it is used to treat roundworm infections, albendazole and mebendazole, and tapeworm infections with albendazole. So basically it produces GI side effect and liver toxicity. So next, coming to the antithyroid drugs. So basically you need to remember methimazole and propylthiouracil. Since propylthiouracil is bound to plasma protein, so these are the drug of choice in case of pregnancy, as these drugs will not cross the placental barrier, so that the child will not be affected. So basically it inhibits the thyroid hormone synthesis. Basically they inhibit the thyroid peroxidase activity, thereby it decreases the synthesis of T3 and T4. So they are used to treat hyperthyroidism and Graves' disease, and side effects are it can cause agranulocytosis and hepatotoxicity. So next coming, this is again a revision. So basically, where do we use thyroid hormones? Thyroxine. So basically it is used to treat myxedema, coma, as well as in case of hypothyroidism, that is the goiter state. Hypothyroidism, goiter. And one more thing you should remember, in case of the hyperthyroidism, what will happen? Hyperthyroidism, there is an increase in the catecholamine sensitivity. So thereby what will happen is there is an increase in the heart rate, there is an increased risk of BP, there is anxiety, etc. To treat this anxiety and to counteract the catecholamine, you need to give a propranolol. So next we have completed example, most important drugs which can be asked in your example from most of the topics. So this is a broad revision, just a brief revision for under what heading the drugs will come, what are their mechanism in general, and what are the uses you need to remember, and what are the adverse effects. So in common, what you need to remember is in your exams, if they ask any side effects, so most commonly any drugs, please remember, any drug can cause hypersensitivity reaction. Any drug which are given through oral route can cause nausea and vomiting. So any drug can cause anaphylaxis, and any drug can cause GI related side effect. That means it can cause diarrhea, it can cause stomach upset, etc. If it is given through IV route, please remember, drugs can cause thrombophlebitis, that is the inflammation of the vein. It can cause abscess formation, it can cause pain, it can cause redness, etc. If you are giving insulin through subcutaneous route, what is the side effect? It can cause hypoglycemia, as well as it can cause lipodystrophy. If it is topical, it can cause allergic reaction, etc. So at least these has to be written for side effects. So if you find this video useful, please do subscribe to I Love Pharmacology, and do not forget to like and click the bell icon for more updates on pharmacology. Thank you and all the best.